Welcome, everyone. It is Friday, and hopefully for most people, whether it's morning, afternoon, or evening, that means something good, and you're going to have a chance to breathe a little bit more the next few days, because we know how busy everyone is. So we want to welcome you to this webinar that is part of the USAID Youth Power 2 initiative, and it's about connecting youth engagement and security, a public health approach for community safety. We can go to the next slide. So my name is Bonnie Politz. We want to introduce ourselves. I am the community of practice champion, but I more often say that I'm co-champion with my colleague. I am in Washington, D.C. I'm an independent youth and community strategy consultant and do a lot of work both domestically and internationally. Mike?
Hello, everyone. Welcome to this amazing coffee chat with Reggie and Bonnie and Gabby. We're very excited to have you here. My name is Mike Hernandez, as Bonnie said. I live in El Salvador. I'm the youth advisor for the community of practice, and I'm very happy to share with you today some thoughts, some great conversations with our colleagues and presenters. Over to you, Bonnie.
So what we're going to do is we're going to have some introductions. We're going to refresh a little bit about what this community of practice is about and the framework that we use to tell stories about what's going on related to systems change. We will introduce the people who are going to be in the conversations. Mike is going to facilitate that conversation. We hope we will then have open discussion with the entire group where you can engage, ask questions, delve a little bit more, and then we'll talk a little bit about what's coming up next for our youth systems strengthening community of practice. Next. Mike?
And if you haven't signed up for youthpower.org, you can look for us over there in youthpower.org, and you can connect with the Youth System Strengthening CoP and some other communities of practice from the initiative Youth Power 2, Learning and Evaluation. Please join us and connect. This webinar and coffee tea chat will be also recorded, and it will be posted later in these platforms.
Okay. Next. So who are we? What is the Youth System Strengthening Community of Practice? We are one of several communities of practice that are being utilized and managed through the Youth Power 2 Learning and Evaluation team. And it's really about having a space, a global space, where we can talk about what's going on to change systems. We know there are lots of wonderful programs going on in countries all around the world that are impacting positive outcomes for youth. But the focus of this particular community of practice is what's happening to change the systems. And this framework was created by a group that I'm connected with called the Youth Systems Collaborative. It is a research-based framework, and we use this as an opportunity for people to pick different parts of the framework to say, what are they doing in their work that's actually impacting, for example, changes in policy, changes in resource flows. That includes budgets, national budgets, local, municipal budgets that are changing because of what we're learning about what it takes to make these positive outcomes for young people. How are services and practices? What mindsets and are changing that allow people to rethink what they may have been doing for the last 40 years that need to be done in a new way to really change and expand positive outcomes for young people. So that's truly the focus of this particular community of practice. The next slide. And these are the members of the Youth Systems Collaborative. These are organizations that have been coming together for almost 5 years now. And while they are competitors and doing work across the world in low and middle income countries, we have come together to share what's being learned about systems change through all of the work they're doing through a variety of donors. There's a paper that's been written, there's work going on to really share and get more research and show the data about what it takes to actually make systemic change in countries around the world, whether it's in the education, youth workforce, health, crime and violence prevention, whatever system it might be, to try and uplift those and share them more broadly. Okay, we'll go to the next slide. So we're really excited today to have this conversation with Gabriela, Gabby, Leva, and Reggie Moore. Gabby brings many years, over 21 years of international development experience throughout Latin America, the Middle East, and South Africa. She's worked on issues related to citizen security. She has worked on reducing international homicide rates in countries around the world, and also specifically about really, in Central America, about having sort of community-wide strategies that are rethought to impact the reduction of violence and the increase of the positive supports for young people around. She's led complex, evidence-informed, and innovative interventions. And she is a lawyer by training, and as she says, a hyper learner by passion. I'm very excited to introduce Reggie Moore. Not that I'm not excited about Gabby, but I've known Reggie for many, many years, since the early 1990s when he was working, doing as a public ally in Milwaukee, Wisconsin. And since then, it's just been wonderful to watch his career grow. He is currently the Director of Violence Prevention Policy and Engagement at the Medical College of Wisconsin in Milwaukee, Wisconsin. He has had incredible amount of 24 years of experience in nonprofit, public health, government, and community leadership. He was director of the Office of Violence Prevention for the City of Milwaukee Health Department, and actually created two organizations, the Center for Youth Engagement and Urban Underground, which both really uplifted the role of young leaders in the Milwaukee community in solving problems and in advancing quality youth development policies and practices. He has been on several national and local boards and is doing just the really great work in one of our cities that needs him desperately. So I'm going to hand this over to Mike now to facilitate this conversation. Thank you.
Thank you, Bonnie. It's a pleasure for me to moderate this conversation. Gabby, Reggie, you guys are experts on this field. And, from across the globe, violence, this topic is very sensitive since it has affected families, communities around the world. And we're trying to make this world a little bit safer and more peaceful, but we would like to hear from you, the experts, the doers, the ones that are in action on the front line of violence prevention. Gabby, you are part of this amazing strategy. You have been working in many countries. You have worked in many countries, and I would like to give the first word to you about violence prevention. I know you have some slides over there you want to share, and then we discuss some other topics.
Thanks, Mike. Speaking to the unique challenges of addressing youth violence through a systemic public health approach, I can speak more to the Latin American Caribbean environment. The main challenge is one of diagnosing the violence. When one uses the public health model for violence prevention that the CDC developed, which basically views violence as an epidemic, we can pull out great examples of places where through this model, the violence has been reduced from 14 murders per day in a very small community to 0 murders per day. The idea is that if we treat violence as contagious, just like you would an outbreak of COVID, cholera, or HIV/AIDS, you can get great results over a relatively short period of time. First, one needs to understand the dynamics of the violence, and I think that's a unique yet consistent challenge in developing countries. It often begins with data collection. Latin America and the Caribbean and other developing countries, data can be scarce and sometimes even non-existent. It is a huge obstacle for making evidence-driven choices. Understanding where the violence occurs, when it's occurring, who are the victims and who are the perpetrators, what types of violence is most critical. Those are the most efficient ways to administer somewhat scarce resources or limited resources and mitigate the violence. There are great examples in the Latin American region, specifically in Central America, of how to improve data collection and analysis from a regional perspective. USAID has partnered with UNDP, for example, to support data collection in Central America and the Dominican Republic through a platform called InfoSegura. This helps government actors, local stakeholders, including youth actors, and international donors direct the resources to the right people, the right places, and towards the right issues. Diagnosing the violence also entails diagnosing the exposure of individuals to the violence. And that is also a key public health approach to this problem. And if, I like to use the example of the movie Contagion, for those of us that like movies. Remember that virus spread like wildfire, started with 2 people who then infected 5 more, and then it was hundreds more. Youth violence is pretty much the same. One youth perpetrator of violence who literally gets away with murder in environments where impunity rates are off the charts. In countries like mine in Honduras, the probability that you can get caught, prosecuted, and brought to trial and then sentenced for your crime is perhaps around 2 to 6%. So that youth then brags about getting away with it and starts flashing around how easy it is to get money, to get street credibility, to get respect out of fear. And pretty soon more kids want to hang around them. That's where the violence prevention pyramid comes in. Understanding where the population is at in these areas is key. There are people in the green block that you want to vaccinate, using the public health approach again, vaccinate against the violence. They're exposed to the violence, but not yet infected. And that's the approach the practitioners take with almost 70% of the youth population. These primary prevention approaches that work to increase protective factors, increase resilience, increase positive peer influence among the youth. And then as you move up the period, there's a smaller group, which evidence shows is approximately 20% of the youth in this yellow block, and the kids are engaging in risky behaviors. There you want to reverse the impulsivity, the exposure to negative peer, the delinquent behaviors, and increase family cohesion and positive peer identity. And as you reach that top of the pyramid, you find a very small percentage who are actually committing the crimes, perpetrating the violence, and enticing others to act like him or her. There you want to reduce those antisocial values, the lack of emotional regulation, antisocial peers. These are your infected patients that you need to work with one-on-one and make sure they stop spreading the violence. And these are the approaches that you can use with tools like risk identification tools to actually identify who is in these specific categories. There are great examples of working with youth through this differentiated approach throughout the Latin American Caribbean region. You can find examples of family counseling programs in my country, Honduras, but also in St. Lucia, St. Kitts and Nevis, school-based programming throughout Central America, in Honduras, El Salvador, Guatemala. There's some great examples of work specifically with youth that have been come in conflict with the law in Mexico and Honduras as well. Only a handful of these violence prevention programs have been evaluated, and that's a huge gap. Yet they have contributed to the violence prevention research in this region, which was non-existent when those of us who first began working in violence prevention around 2009. There were none. And so now with the richness of transferability, communication, these types of webinars, we found more and more opportunities to replicate and spread the word around, get the good work to spread out. Thank you.
Thank you, Gabby. We will hear more about some concrete actions that you have worked on. And I want to give the word to Reggie. He has also a vast experience about violence prevention over there in Wisconsin. Reggie, over to you.
Good morning, and thank you, Mike. And also thank you, Bonnie, and appreciate everyone who's able to join this morning. In terms of violence prevention, one of the things I want to start with, and this is actually how Bonnie and I first met, back in the late 90s, there was sort of a movement in the United States to move from looking at young people as problems or sort of as deficits, and really looking at how do we center them as the agents of change in their communities, in their own lives, being able to advocate for themselves and their needs, but then also for their neighborhoods and families. And that movement is sort of what really led to sort of the creation of a youth advocacy group here called Urban Underground, which our current county executive in Milwaukee County is an alumni of. And although it wasn't necessarily designed for folks to necessarily go into elected office, when you think about the skills that you develop through organizing and advocacy and activism, it really is about being public servant minded and public service minded, and really around how do you channel your concerns to actually bring about the change that you want to see in the world. And so with that being said, the importance of when we think about what's happening, particularly with young people in the United States and the impact of gun violence is pretty profound. Are we, Mike, going to slides? Can we reference slides at this point? Okay, if we can go to the first slide. In 2016, we launched a process in Milwaukee to really have residents from neighborhoods who are disproportionately impacted by violence in our city, including young people, identify the priorities for addressing violence as a public health issue. And that resulted in what we call the Blueprint for Peace. And in the middle circle here is the vision behind the blueprint. But basically, we have a city where is a resilient city where the lives of our residents are valued, promoted, and protected. And then surrounding that circle are the 6 goals that emerged from the blueprint. And with each of those goals are very specific strategies that, again, are not only evidence-based or evidence-informed, but also were prioritized by residents in the city. And we surveyed and engaged over 1,000 young people and really asked if resources weren't an issue, if you had all of the, power in the world, which I would argue they, in some cases, should, maybe we'll have a better world. What would you do to increase community safety in the city? And, questions around where they felt least safe, where they felt most safe. And what really resonated from their engagement is, number one, the places that we may assume that they felt least safe is where they felt most safe. And a lot of that had to do with their connection with each other, but also a connection with a consistent, competent, caring adult in their life. Whether they found that in their home, whether they found that in a teacher, in a faith or religious-based organization, whatever it was, we found that that was paramount. If we can go to the next slide. And unfortunately, a significant barrier to young people being successful is being able to stay alive. And unfortunately, in America, firearms have become the leading cause of death for American children and teens. And this is data from the CDC. And when you think about other forms of mortality in terms of motor vehicle accidents, poisoning, cancer, suffocation, COVID-19, gun violence, unfortunately, since 2020 has become the leading cause of death. And so that, to me, should scream alarms for advocates, for elected officials, for organizers, anyone that cares about children and youth, regardless of what country you may represent. This is something that should be intolerable throughout the world, but especially here in the United States. Next slide. And so, as Gabriela mentioned, we actually have adopted an approach operationalizing that, looking at violence as a disease and understanding that you can't interrupt transmission. You can reduce the likelihood of individuals being harmed or harming others or themselves. And then also understanding that we also have to change community norms about the way that we view violence. So the deeper that exposure, the more normalized it can become. And I can speak to that firsthand, growing up in this city and my own exposure to violence, and understanding that in many cases, it becomes an issue of survival where you feel like, you have to move in a certain way. There's been surveys done in Chicago, for example, by the Joyce Foundation, when they surveyed young people who were around their views around firearms. Many of them, over 90%, who did admit to carrying firearms, said that they did it out of fear of harm. And so it was less about wanting to harm other people and more so around their fear of being in a situation where a firearm was produced and they didn't have one, not recognizing that that won't necessarily reduce your odds of being harmed. And so again, changing those norms are critically important, and understanding that there are things that we can do to really engage with those who are at highest risk of shooting or being shot. And we are producing some significant results. And this model is also it has been evaluated around the country, and we're also undertaking an evaluation here in the city of Milwaukee. Next slide. And then lastly, really highlighting the approach we took with addressing violence as a public health issue is understanding that we often talk about trauma as an individual experience, meaning some traumatic event or exposure to trauma, whether that be violence. And I would also want to underscore that violence can also be produced by policy. And so it's really important to understand the environmental conditions that increase the likelihood for communities and individuals and families to experience violence. And so as we work to mitigate the production and experience of individuals exposed to trauma and violence, we also have to understand and pursue solutions around making sure that the entire community has access to equitable opportunity, that individuals have access to quality healthcare and education, and that the physical environment in terms of quality housing, transportation are also considered as well. So that's the approach that we've taken in terms of operationalizing the idea of addressing violence as a public health issue. Thank you.
Thank you, Reggie. We saw Edwin Oiko. Did you raise your hand to give your opinion? Do you want to share something?
Okay, I wanted to ask Gabriela to pardon the points that she was putting across. I didn't get it. Have you heard? I was pointing to Gabriela that she should put the point that she wanted to put across. I missed a bit. Okay.
Can you be a little bit more specific about which, because she said several things. I'm not sure which, or you want to put it in.
You want to type it in the chat, Edwin? It will be good if you type them.
Let me tape the point on the chat box.
All right. Thank you, Edwin. Thank you very much.
Okay.
Okay. Thanks, Reggie and Gabriela. I have a question for you because you have spoken about strategies, policies, initiatives, and for us, I live in a country where violence affected not only my community but also my family. And El Salvador was one of the most dangerous countries in the world. I believe for a couple of years it was #1 in the world, and it hurt a lot. It hurt a lot. But I want to ask you about the challenges, those unique challenges that when you address youth violence, they just appear. And I know some fellows from Guatemala that they also work in violence prevention. They pointed out how difficult it was to collect data. It was difficult to go to the places and collect data and analyze it because of the same phenomenon of violence. What are those unique challenges, Gabriela and Reggie, that people face, that you guys face when addressing youth violence prevention? I will start with Gabby.
That's, I share your pain, Mike. I'm from Honduras. I've lived and breathed the violence, and I think the communities that, we serve through these donor-funded programs live and breathe this violence on a daily basis. And it was always a very sad exercise to ask people in a small room to raise their hands if they knew somebody who had been exposed to the violence, if someone in their close circle had been exposed to the violence, or if they themselves were exposed to the violence. And more often than not, more than half of the room raised their hands throughout those 3 questions. And so I think the biggest challenge is that everybody is living in a constant state of hypervigilance, emergency. This is life-threatening to everybody. It affects decision makers, it affects policymakers, it affects the communities that live there, it affects the families, it affects the schools, it affects everybody. It is very hard to conduct development work in an environment where everybody fears for their lives. It becomes a matter of how do you promote systemic change while operationalizing a very, it's a now problem, a strategy that preserves life now. And so from the vision of government actors, they want the data collection you mentioned, and I alluded to this earlier, understanding where it occurs. 10%, I'm sorry, 90% of the violence occurs in approximately 10% of a city. It's a very small area. And so being able to pinpoint that in this district, on these 2 streets, on Sunday between 5 and 9 p.m., the violence occurs is critical. I mean, I cannot stress this enough. To understand where it is occurring is the first step. Who it is affecting. In Honduras and in these Central American countries, young males between 14 and 17 are disproportionately affected by this violence. And when I say disproportionately, we're talking over 300% more than every other segment of the population. And you have to remember also, I can speak to developing countries. These are young countries. The majority of the population are below 35. And so when you're saying that this segment, below 35, is the most affected by violence, and within that segment, young males between 14 and 17, those are kids, those are our children. And so being able to have this informed conversation with local governments, with the police, with the judges and prosecutors that bring this to trial, because they also have to understand that everybody's struggling and they have to be part of the conversation. And I think more importantly, young people, the people that are being affected by the violence, need to be at the table. They have to be advocates, as Reggie mentioned, for their own change. They have to provide part of the solution, because it's oftentimes adults talking about the issue of violence for youth. And it is youth that typically come up with the greatest ideas. There are great examples in the region. I can cite Movimiento de Jóvenes contra la Violencia as one that across the board advocated, implemented, and really made their presence felt through different strategies that, I think adults could not have thought of. They went into the schools and talked to the students, talked to the teachers, talked to the families about, let's sit down to the dining table, something so simple. And that promotes family cohesion, that promotes, having an informed conversation. It increases the protective factors that the youth need. Oftentimes, these are youth that are seeking peer identities, and we can speak to the case of gangs. What they want is to belong to that cool group, the group that has respect, whether that respect is gained through, illicit means or gun violence or threats. But those are the kids that have respect and typically have, a cash. So those are the things that I would say are the challenges that we need to overcome, is understanding the violence, bringing folks to the table that have the resources, that have the responsibility, because security is also a public service. Just like you get education, just like you get health, security is a public service. But if the police are scared to go into an area because it is completely controlled, seized by illicit actors, then you have a bigger problem. So even the police needs help sometimes. They have their heart in the right place, but they don't have the tools, they don't have the data. So everyone needs to garner around the issue of understanding the dynamics of violence and proposing approaches that are systemic, yes, long-term, yes, but operationalize them today. Thank you.
I know a very successful case or initiative from Honduras by this organization, Warriors. They create rap, hip hop, and I have worked with them for a long time, and I like this idea that you just said. The best ideas come from young people, and they have this amazing idea. And I say, how do you do it? Because violence prevention is on the red alert, on the red flag over there, but the actors, the doers, are the same young people. And they said it's because these initiatives are made by young to young people. And that is the first step. You need to start doing it at the same level that they feel comfortable with, the same language, the same dressing code. And I want to pass it to Reggie. Reggie, very shortly, some unique challenges that you have faced in your experience.
I'll just say, and I put a link to the Blueprint for Peace in the chat, briefly, that what is valued is what gets measured, and what gets invested in. And unfortunately, in many countries, including the United States, young people are feared, especially when you're talking about teenagers. So, definitely beyond early childhood. And the unfortunate is that young people feel that. They feel when they are not welcome, when they don't feel that the environment that they're living in is not supportive, when they go to schools that are not resourced. All of those things contribute to needs going unmet. And like Gabriela mentioned, young people will find ways to meet those needs. And so we have to look upstream and to say, from a primary prevention perspective, how do we help individuals who control policy and investment and resources to say we have to invest in young people? A young person shouldn't have to get in trouble to get the help that they need or to be invested in. And unfortunately, we often invest in the problem or the back end or the containment or control of the problem versus looking at how do we invest in preventing the problem on the front end. And it's also important that data is not weaponized against young people or the community. The average shooter in our city is 29 years old. But if you ask any adult on the street, they would say that it's teenagers who are doing the majority of the shooting. And again, I know that may be the reality in other contexts, but in the United States, oftentimes young people can be burdened unfairly with, particularly as it relates to gun violence, but they definitely, as the earlier data showed, are being victimized by it. And oftentimes they're being shot by adults. And so those are just things that we have had to navigate, is to, one, increase and make sure people value young people, their lives, their voices, and their contributions to solutions.
Thank you, Reggie. And I always said that governments that invest too much in repression will fail in terms of prevention, because prevention is the first step. We need to take a look at what's happening in the communities, who are the stakeholders that will be supporting us. And Gabby said that it's important to get local governments, police, young people, and community leaders into these strategies. And this will lead me to my next question. How can community stakeholders, including young people, be effectively engaged in the development and implementation of public health strategies for preventing youth violence? Sometimes NGOs, foundation, government policies just come, but they don't take into account the people that are being affected, the people in that communities. And this is what calls my attention from this organization in Honduras. All people involved in the strategies, programs, and hip hop initiatives are young people, by young, for young, and with young people. So how can we get these community stakeholders engaged in this long road of violence prevention? Let's start with you today, Reggie.
So we've taken a couple of approaches. One, elevating violence as a public health issue has been the leading frame, and understanding that the cost of simply treating the problem, whether that be through healthcare, through incarceration, law enforcement, is not fiscally feasible. And the amount required to invest on the front end, the return on investment in that is profound. Making sure that young people and families and neighborhoods have what they need is smart public policy and is smart public safety. And oftentimes, unfortunately, because we haven't looked at violence as a public health issue to the degree that we should, most of the investment has gone on the treatment side of the problem. And again, in terms of the care of the injured, in incarceration, prosecution, et cetera. And so it really is about taking that comprehensive approach and understanding that if we don't invest in young people and center them in the solutions, we're going to pay for it in multiple ways on the back end. And so that's been the way that we've, in terms of working with, whether it be policymakers, government officials, nonprofits, et cetera, and also helping everyone understand that you have a role to play. So whether you work in the media, whether you work in an NGO, whether you work in education, business, the private sector, everyone has a role to play in ensuring that our communities are safe and that our young people and families have what they need to thrive.
Gabby?
It's hard to come in after that response from Reggie, because that is precisely the case, I think, across the board. I mean, Reggie, you speak to the US. I think that's incredibly applicable to the countries where I've been able to work. And what I'll add perhaps is there are some great experiences of working through local governments. I mean, in developing countries, and I can speak more about this in Central America, Mexico, and even some Caribbean nations, what you have is an absence of state. What you have is an absence of authority, and you have fractured communities. And so how do you restore the social fabric that allows us to brainstorm together and bring people that need to be around the same table for a discussion around these issues? These communities live and breathe the violence every day, and they're scared for good reason. And so bringing people together at a community level, but more importantly, bringing the community together with local authorities is a great first step in trying to not only educate across the board, because I think all of us benefit from sitting together and hearing about, how you would tackle this from a public health approach. Many of these countries are struggling to deal with everyday problems such as, lack of water, a lack of electricity shortages, and education dropouts. Everybody has their own sector problems in their mind, and it's hard to wrap their heads around their sector plus violence. And so I think having people sit together at the table and kind of think, if I'm a teacher and I'm having to have my kids duck under the table because there's shooting going on, that affects your education outcomes. That violence is creeping into your educational setting. So how do you work together with educators, school district directors, education officials at the higher level, national level, to really address the violence that is occurring within the school setting, recruitment of kids from within the school, and the violence occurring outside the school? If you're talking about a mayor and the police chief and they're dealing with the violence, how do you help them have these conversations from peer to peer with the community who are suffering the violence? And as Reggie mentioned, not stigmatize them for living in a place that is violence ridden. They're not violent places. They are violent. They suffer the violence just like everybody else. And so having this conversation, and I want to bring it back to young people, just like Reggie mentioned, the violence is occurring to the young people. So having them at the table, both as advocates for their families, because everybody's young, everybody has a family, everybody has a mother, a brother, a cousin, or your best friend that's being affected by this. So you can bring different voices to the table and brainstorm around each other. And I think it really opens people's minds, especially decision makers, policy makers, when you hear these testimonies and when you hear about the violence that is occurring in specific places. So rather than just seeing statistics and data and talking about how you reduce a homicide rate from 84 at a national level, how can you reduce that homicide rate in a very specific area? And that then you chip at a problem, you actually chew on that problem. Thank you.
When you mentioned about the school problem, that made me feel a little bit sad. But when I was in high school, I had to work from my house. My high school was like 6 blocks from my house, but I had to cross a park. And every day I was stopped by a gang member to take out my money for lunch. And that affected me and my classmates. And in our psychology class, I remember this time with this teacher, almost all of our classmates were assaulted, and we were taking away our money. And that class couldn't be developed because we were all complaining about what the police was doing, about what we can do. So it's sad, but I'm glad that so many years after my high school years, organizations and people like you and Reggie are working on this at this level on this issue. Bonnie has her hand lifted, and after that, I'll get to a question from Itza. And then Stephanie. Bonnie.
Great. Oh, this is wonderful. Stephanie, could you put up the slide with the triangle? You know, part of when people say, how can you bring people together? What makes a difference? Sometimes pictures, you know, make a big difference versus a 10-page paper. Sometimes a picture can spark a conversation. And this picture we've been using for so many years in different ways, Reggie, you'll remember, but basically an opportunity to talk about this at the community level is, where's the money going? The money is going into that very top part of the triangle for the least amount of young people who are getting locked up, and what we have to pay for them to be locked up, what we pay for security, what we pay for all of those 24-hour incarcerated services, whether it's detention or long-term. All of that money is being spent on the least amount of young people. And most of the young people are down in the green part. So the question and the opportunity for when you're bringing mayors and governors and municipal leaders together is, where's the opportunity to shift where our money is going? Because if we know that our money is going to support that bottom part with after-school programs, mental health programs, mentoring programs, job training programs, the things we need to saturate communities with, over time, we will see a reduction in the top part. That's going to take years and years. But part of it is a budget and policy discussion about, where is our money going? And is it going in the right direction? And does it need to be thought of in a new way, collaboratively across systems? Is it the police department and the school department and the health department need to sit together and look at their budgets and say, we need to be moving these things around so there's more coming into that green area over the next 10 to 15 years, so we see that reduction. So I just wanted to make that point, that sometimes a picture can be used with people who don't understand why they may be there or why it's important for them to be there, including public officials, business leaders, who need to sort of see where they can fit into this puzzle. So that was it. Just wanted to mention
Thank
that.
you, Bonnie. Thank
Bonnie,
you, Bonnie.
Yeah.
Bonnie and Mike, if I may interject. I wholeheartedly agree with you, Bonnie, but I would say in the cases of the Central American countries and Caribbean countries, I would say that is the reverse, the exact opposite. The money's going to prevention, to that 70%. And it makes sense, right? It's easy, you can do group activities, you can do a lot of work, but then there is a gap. And not addressing the top part of that triangle has very high consequences, because then you are in fact allowing the violence to spread, just like you would a disease. And so in Central America, in Mexico, in the Caribbean, even in countries where I would never have expected to have to work, like Ecuador, who are now experiencing a high level of gang violence, where the local governments and the police are typically putting resources is into that green part of the triangle. And what they're leaving out is the top part. So I would say it may be the case for the US, but I would advocate for a completely different conversation in the case of Central American countries, because the money, it's a higher ticket, that's for sure. The price tag of working one-on-one with the secondary and tertiary level population is much higher. You can't just go out and do a street type of activity or put together an after-school program that would service 600 kids at once. You need to go one-on-one, and that's a higher ticket. That's just the reality, but that's where the money's not going. I just wanted to make a plug for that.
Yes, yes, absolutely. I was going to say something related to that. In El Salvador, there's a huge amount of money that goes to prevention, and there are a lot of opportunities from creatives, USAID, World Vision, and some other stakeholders that are investing a lot of money into prevention activities. And results are there. Results are there. Data is there. And El Salvador is a very critical, has a very difficult issue with politics and violence prevention, but that's another topic that we can discuss later. Julius, I'm sorry, Itza says, thank you for such a rich conversation. Gabby, it's always a privilege to learn from your expertise and passion for youth development. You've touched on the challenges. What would you say are the opportunities, the strategic players or entry points that are sometimes overlooked? And then I will give the word to Julius, I believe, or Edwin. After Gabby's responses, Edwin will have the chance.
Thanks for the question. Hi, Itza. It's a tough one because I think in the case of Central America, Honduras tends to be in the front runner of looking for those opportunities and strategic players. We've been dealing with the violence for so long that we're no longer winging it. We know what works. That being said, I think there are more opportunities to be explored with the business sector. I don't think that we have yet tapped into them as key actors and generating the types of opportunities that we should be generating for youth. There is something to be said for the cases of youth in these developing countries. For example, you talk about youth and their need to have education, their need to have an employment, but we rarely discuss the fact that teen pregnancy is such a big issue. The opportunity to provide sexual and reproductive health, education and services for young parents in countries where teen pregnancy is such a high prevalence. I think there's a missed opportunity there. There are some great examples of installing health services within the education centers, and I think that needs to be replicated. But more importantly, we are, I think, decades behind trying to reduce the teen pregnancy and advocate for, nobody births a child and knows what to do with them. We're all, for those of us that are parents, how I wish I would have had a manual. Now my child is 24 years old, but back then I was struggling to understand how not to push him away, how to make conversation, how to keep the communication, how to increase social, our family cohesion. And all of these tools that we know work to prevent the violence, we should be replicating and educating this population. And for countries that, again, I stated before, have such a young population to begin with, those are strategies that I think could be explored further. In addition to that, I'll just, and this is perhaps from a personal experience, I think there's more to be done from the education sector. While there are great examples, and I'll name one, Asegurando la Educación, it's a violence prevention program from an education perspective, but there's other like Glasswing and the work that they're doing in trying to link education after school programs to violence prevention outcomes. And I think the intentionality of linking development challenges like education, like health, like reducing teen pregnancy, etc., need to be purposely linked to violence prevention outcomes. And when you think about the problem set as such, I think opportunities reveal themselves. And as far as strategic players, I cannot stress it more. We need to bring youth on board. And I know there are some great examples of having youth advisory groups embedded into these initiatives. What can a youth advisory group say to a group at a local government level? What can the youth advisory group speak to when speaking to security actors? Those are the types of opportunities that I think need to be tapped into, that need to be explored, because youth have something to say for them and by them. And I think that's where we often leave the conversation to adults. And mind you, the definition of USAID, for example, of youth is up to 29 years old. I had a kid when I was 29, right? But what happens to these youth? And you have to think about the variety of youth, a youth in school, a youth out of school, a youth struggling to, bring food to the table for their family, a youth struggling to be a parent, a single parent, So there's that.
Reggie, I'd like to hear from your experience also to answer this question. I read, what would you say are the opportunities, strategic players, or entry points that are sometimes overlooked?
I would just echo what Gabriela said in terms of ensuring that the voices of those who are disproportionately impacted by the violence, that their voices are valued and centered in that process, and doing everything possible to create that space with young people, not just for them, but with them, and protecting that space. And also being willing to stay at the table. Oftentimes we, because people will make mistakes, people, and especially when you're bringing folks together for the first time where they have not been in relationship with each other. And I'll just give a quick example. When we launched the Blueprint for Peace process in Milwaukee, at our launch event, we had about 150 people in a room, and there were young people there from the community. And for many of them, this was their first time in the same space with the mayor, with the police chief, with the district attorney, and being able to share that in addition to their concern about experiencing violence from their community or in their community, they also had experienced violence from law enforcement and from systems in their community. And people you can't dismiss or deny people's experiences. And you have to, and in terms of the system leaders who were there and the policymakers and the law enforcement leaders who were there, they have to be willing to stay, hear that, understand it, and be responsive to it. And so I just want to underscore, it's not just about, and we all have said it, so I'm saying this to myself as well, just as a reminder, it's not just about hearing young people, it's also about, or the community as a whole, it's also about being responsive to it. And so when we look at the level of investment that communities across the United States currently are making in addressing violence as a public health issue, it's unprecedented. And so this is something that we want to see sustained. And I think, Mike, I think you said this earlier, addressing community safety has to be embedded in what we do just as much as trash collection, libraries, healthcare, and law enforcement. Like, we have to understand, like, we have to invest in communities if we are going to produce safer communities. And so that's a paradigm that's really important to uplift.
Yes, Gabriela just pointed out a young person's first contact with the police is so important. Thank you for highlighting that, Reggie. And also, I have some opinions from Julius. He said, young people should be given privileged right from school responsibility and leadership. They should be given task because responsibility make one people responsible. Thank you. And Julius also said, leaders should give room for mistake and room to improve. That's what you were mentioning, Reggie. And Edwin would like to share something with us. Edwin, you can open your microphone if you can, or if not, you can type it on the chat.
Okay, now I'm okay.
Thank you.
Yeah, I was looking upon the opportunities and the strategic players and the entry points. From our country, yeah, which is a developing country, the opportunities are much more not considered, because the only thing that the public figures and the public officials and the public itself, they only consider preventing something, that is the preventive measures, and forgetting about the corrective measures. The corrective measures, which is understanding the problem, bringing the solution to the problem, you correct the problem so that it cannot happen again. Under the opportunity, that's the first thing they should do, is they should bring study issues and discussions and forums between the public and the public officials to bring a corrective way of preventing the problem. They first have to correct the problem, then prevent. If the problem may happen in the future, they should bring another way to make sure that the future is prevented from the things that are to happen. Then where they form policies, that is as opportunities, most of the opportunities are misled by our public officials, because in these developing countries, in every security arena, there's like corruption in every steps. depending whether the youth, old, that is bringing another issue. Then in communities, security, the security is most concerned by the youth that who cause the problem. That is from the age of 17 here in our country, Kenya, to the age of 29. Because at that age, there is this they call depressions and the media issues that they want to compete with what they see in the media. And that is actually leading to more of the violences in our communities. So if the key strategic players here to be done is that the government or the public officials and the public itself, they should form forums that should be conducted, because most of the people or the youths and the young generations, they prefer the online work, but they are more convinced or more assured with the face-to-face communication. The Generation Z, which is currently this is the 21st century. This young generation is suffering from depressions and the mental health conditions. After the COVID-19 era, the crisis of violence has increased here. And the officials, that is the police departments in our country as a challenge, they normally have this tendency of bullying the youth, whether you are a good person or whether you are not a good person. It doesn't depend. So you'll find that at our areas, even if you are a good person, you might find yourself engaging into the violence of the community. Because if the government itself, it ain't friendly to ask you where the issue is, it is just bullying you and giving you a lot of depressions. Like when at the age of 18 to 24, and you are a man, it is a dangerous age in our city, because whether you are a good person or not, at any time where you come across any police departments, they'll just arrest you or bully you and mistreat you. And that is leading to most of our youths to have that mindset that if
Edwin, thank you very much for your participation. We're running out of time, and I would like to close up this conversation. And I invite you to join the youthpower.org COP website so we can have that conversation over there, and you can share most of your insights with us in the platform. I will have to pass it to Bonnie, Reggie, and Gabby. It's been a pleasure to talk to you, to share, and to learn also from your practices and your experience. From developing country in El Salvador, I thank you for all the effort you have done in Central America, in the United States, and some other parts of the world, the people that are joining here. And if they're doing some efforts for violent prevention, thank you. Thank you very much, Gabriela and Reggie. Bonnie, over to you.
Thanks so much. I do want to just take a second. If you had something to say in reaction to what Edwin said, I mean, if there's anything you want to just say very quickly, we're so sorry we had to cut that short. So Edwin, I hope you will put more in. But if there's anything Reggie or Gabby you want to say in reaction to what he said, if not, that's okay too. Go ahead.
I was just going to say, I feel Edwin's pain. I think we've all, at some point in our careers, been witness to that, and it's unfortunate, but I think those are phases, and sometimes it's painful, but you need to go through it to fix the problem. And in developing countries, the police are often, they are frustrated. They have a huge mandate that they don't know what to do with, and so it's not to make an excuse for them, but it is to be a reflection that the police are also struggling with a dilemma. And the more that we have conversations and the more that we can engage youth to have conversations with the police in a controlled environment, not a confrontational environment, where youth are able to share their experiences and call them out for overstepping, for using excessive use of force, for overstepping their authority and detaining them for random reasons on the streets. But more importantly, to brainstorm together, as Reggie mentioned, where is the problem coming from, and is it really youth? And if it's really youth, and then what can you do to address it accordingly, and not just stigmatize youth because they are young, by the way they dress, where they hang out, where they live. And so I think having the conversation when those situations occur, donors have a huge role in being brokers of these conversations. And so there's something to think about there. And there are so many organizations doing great work at the community level that can also broker these conversations. Thank you.
And I did also make a comment in the chat, but just, affirming, Edwin, that perspective and understanding that, even in the United States, in 2020 with the murder of George Floyd and the protests that resulted from that and the policy changes that have been called for, recognizing that when there's a breakdown in trust and legitimacy of agencies that are expected, to provide services around public safety, when that trust and relationship and breakdown in terms of respecting of rights, when those things are absent, that actually increases the environment for violence to flourish, when there's a lack of accountability from the system, by the system as well, and owning the things that they need to do to improve.
Thanks, Reggie and Gabby. Thank you so much. As Mike said, we just really appreciate it. I think as we're thinking about a follow-up session, at some point, maybe we would have the two of you with each maybe bringing, having a young person who you're working with in Milwaukee and in one of your sites, Gabby, and have expand the conversation out with more young people. That would be great to hear about solutions and opportunities. So just wanted to look at the last slide. We want to thank everybody. Thank you for staying on. We know it went over a little bit. We do have, we're going to be doing a, in the Learning Network, there's another event happening about business entrepreneurship and private sector engagement, and young entrepreneurs in Kenya. There will be a May 3rd Gender Community of Practice call. And in June, we will have our next webinar, which for this community of practice about embedding systems change in proposal grants and opportunities. EDC will do a presentation based on work they're doing globally related to embedding systems work in their proposals. So it'll be more really tangible, get in there and get some work to learn about how it's working. So thank you, everybody. Thank you, Mike. Thank you, Gabby and Reggie and everybody who participated. We hope some of this was helpful. People have put some great comments in the chat. Please take the connections and the links and all of that. So have a wonderful day and weekend, everyone, wherever you are around the world.